Chapter 16, Work-Life Balance. After my break, I sat at my station and logged back into my computer. I made sure to let Rita know that I was back from lunch. Saying nothing, she took a bite of her egg sandwich and handed me a case file. I opened the chart and learned about my newest patient. 4-year-old biracial female, complaining of itchiness and diarrhea. I entered the room and introduced myself. I made sure to make eye contact with the child first, as I always did, and then acknowledged the adult. "Are you Dad?" I asked the man standing beside the bed.
"Yes, I am her father."
"So, tell me about Nala." When he just stared back at me, I figured he didn't understand the question, so I rephrased. "What brings you to the emergency room?"
"Oh right, she has diarrhea and a rash."
He explained, pointing at her legs. "Does she have any food or drug allergies that you know of?"
"Nope."
"When did the rash start?" I asked as I wrote notes in her chart.
"I'm not sure. She stays with her mom during the week. I pick her up every other weekend."
He explained. "I see. Nala, sweetie, I'm going to wrap this cuff around your arm. It's going to hug you real tight, but only for a minute and it won't hurt." I talked her through everything I did, trying my best to make her feel comfortable. Her blood pressure, oxygen levels, and temperature were all normal. "Nala, I'd like to look at your rash. Do you think that would be okay?" When Nala gave verbal permission, I examined her legs and arms, palpitating large raised bumps. I lifted her shirt slightly to look at her stomach and back. "Nala, do you remember what you ate for dinner? Anything new? Possibly something you've never eaten before?"
"I can't remember."
Nala answered pitifully, starting to scratch her arms. "Mr. Milton, what did Nala eat for dinner?"
"She had a hot dog and some chips, I believe."
"Oh, now I remember. I did have a hot dog, chips, and I even had some cake when you were outside talking to Mr. Billy."
Nala perked up a bit as she spoke.
"You did?"
The dad asked, surprised. "I see. Now we're getting somewhere. That was very helpful, Nala. I have a couple more questions, though. Do you remember what kind of cake it was?"
"Cheesecake."
She said, grinning ear to ear. "Nala, was there anything on top of your cheesecake? Whipped cream? Chocolate? Nuts?"
"Yes, it had little blue balls on it. I didn't like them, so I pushed them off."
Nala admitted. "Have you ever tasted those before?" I asked, thinking I may have pinpointed the culprit.
"No, they were yucky."
"Thank you so much for all your help." I gave her a high five and stood up to speak with her father. "Mr. Milton, I think she may be having allergic reaction to the blueberries. I do recommend having an allergy panel done with her pediatrician. For now, I'm going to order some diphenhydramine for the itching, and if I'm right, the rash will go away in a couple hours. Do your best to keep her away from blueberries until the allergy test results come back. More severe reactions occur every time someone comes in contact with an allergen."
"Thank you,"
he replied. When I walked out, Mr. Milton followed me into the hallway. "Mr. Milton, do you have another question?"
Yes, what about the diarrhea?"
"Give her a banana when you get home." He just stared at me for a few seconds without saying anything. "Mr. Milton, are you feeling okay?"
Yes. This may sound crazy, but did you by chance ever live in Carolina Arms?"
"Yes, I grew up there. Why?"
"It's me, Randy. I used to live there with my father, and I knew you when we were kids."
"Oh my gosh, Randy Milton. Yes, I remember you, of course. The house on the corner, right?"
"Yeah, I had a huge crush on you back then."
He admitted boyishly. "Yeah, me too. You look different. You're taller now. Also, you replaced the braces with a beard. How have you been?"
"I'm good. We really should catch up. Would it be okay if I got your phone number?"
The rest of my shift that night, I worked with Dr. Zavala. I still remember our first shift working together. The emergency room was flooded with patients. That was the first time I witnessed firsthand what drowning felt like. Normally, we worked on a 4-to-1 ratio. 4 patients to 1 nurse, but that night it was more like 7 to 1. I tried my best to work my own cases and make time to help the others, but people just kept swarming in. Several of us got paged to a patient who was critical. He'd arrived minutes ago, driven to the hospital by his wife. He was mid-40s, white male who was thrown from a horse on his farm. I tried to focus and follow along confidently, but I was struggling internally.
You. I need you to help me do a needle thoracostomy.
Dr. Zavala said, pointing at me when he entered the room. A needle decompression, sir?
Yes, you do the right, and I'll do the left.
He said, snappily. The patient had 2 collapsed lungs, so Dr. Z was basically asking me to thread a thick needle through the first and second intercostal space, between 2 ribs. I was petrified. The needle had a tube attached to it with a valve that allowed for the trapped air to expel from the lungs. The patient was prepped and ready for insertion, and when I looked up, Dr. Zavala was already starting his side.
Nurse, what are you waiting for?
I don't think I can do this,
Haven't you ever put in a vent?
Dr. Zavala asked, stopping briefly. Well, yes, technically, but it was on a cadaver, not a living person.
Oh, that's just perfect, because he won't be a living person if you don't push that needle through with me. Right now.
Dr. Zavala's voice rang out in my head, and I pushed the needle through. I was so glad that I did it, and that it worked. When the man started to breathe, I felt a sense of accomplishment, and I was damn proud of myself. I didn't actually earn my stripes until a few months later. After 4.5 months on the job, I was still considered a new nurse. I had a female patient come in presenting with severe abdominal pains. She was mid-30s. White female, and I did everything within my scope of practice to help her. When I received the ultrasounds, complete blood cell count, and some other test results, I delivered them immediately, by hand, to Dr. Zavala.
Ultrasound is clear. Nothing funky in the blood work. Give the patient pain meds and get her ready to be discharged.
Yes, sir. I went back down and did everything that the doctor asked me to do. Within minutes of receiving morphine, she was doubled over in pain and crying. No one should still be in pain after receiving morphine. I found Dr. Zavala again and informed him of the patient's current status. Dr. Zavala, something isn't right with Mrs. Belak, the patient in room 3. I gave her morphine per your orders, but she said she's in 10 out of 10 pain. She's also vomiting now, and I know that ultrasound didn't show anything. I was telling him before he cut me off.
Get her pain controlled and send her home.
Her white blood cell count was slightly elevated. I'm almost positive that morphine has the opposite effect if you have gallbladder disease.
You want me to order a HIDA scan on a patient with no insurance?
He asked, looking at me like I was stupid. Yes.
No.
No?
Yes?
Wait. I'm confused, yes or no to the scan.
No.
He said enthusiastically and shaking his head from side to side. Okay, you're the boss. But I did already annotate that the patient is in 10 out of 10 pain with a tender abdomen and uncontrolled nausea and vomiting. If we discharge her, she'll just be back tomorrow, I said, handing him the file. Needless to say, he ended up signing off on the HIDA scan, and we found out later that evening that it was an issue with the gallbladder. I was happy that I had potentially saved a patient's life, and Dr. Zavala was happy that I potentially saved his ass. I didn't realize I was daydreaming until a patient started coding behind me.